Well, we start in South Sudan, where 15 children are confirmed to have died as a result of health complications caused by unsterilized syringes. According to the country's health minister, Riek Gai Kok, a team of health workers who carried out a vaccination exercise on 300 children in 2 states was not fully qualified. In this regard, they repeatedly used the same syringes on more than one child without sterilizing them. Another 32 have since recovered. The vaccination drive was carried out in May in Eastern Equatoria. Apart from violence and famine, the world's youngest nation continues to face challenges in the provision of basic services, including healthcare, to its citizens.
The Minister of Health has commissioned a multi-agency administrative committee to review the AEFI report and give appropriate recommendations for further actions to improve immunization service delivery.
Indeed, a disturbing development there in South Sudan. Let's get you more on this. I'm joined on the phone by CGTN's Patrick Oyet in Juba. Patrick, definitely a very serious medical disaster there. What is government's response and how are they planning to proceed going forward?
Yes, Lindy, first of all, the government has actually said it expresses its deep regret for the death of the 15 children which occurred in the eastern part of the country in a place actually called Capoeira. And then the government has said that it will investigate the incident, of course, with a view to finding a way of improving immunization campaign in the country, and of course also finding if it is necessary to compensate the families of the victims of that immunization incident. Of course, the health service delivery in this country, South Sudan, is a very big challenge, and immunization has been one of the success stories until this incident occurred. So that is what the government is saying. It will investigate. It will find out a way of improving immunization campaign in the country.
And indeed, as you say, the government regrets the incident. But how was it that an unqualified team was assigned with this vaccination campaign? I mean, will a new team be taking over if indeed this campaign will continue?
Yes, the government has said that, of course, in Capoeira, the campaign has been stopped. However, in other parts of the country, the campaign is continuing. The immunization campaign, the minister has said that instead, they will even go to opposition-held areas. He says that immunization is open to even opposition-held areas. They are going to go ahead with immunization because this is one, as I said before, is one of the success stories. Because also, last year alone, in 2016, more than 2,000 cases of measles were reported according to UN reports. And already this year, even 1 person died of measles. So the government says it will not stop the campaign. It will just investigate and find out better ways of moving forward from now on. And of course, as you asked earlier also about the underage children administering this kind of vaccination, is because the government says that it has very many agencies that it works in collaboration with. So that's why it wants to still investigate further and see which agency had actually employed those people.
Well, thanks very much. Patrick Oyet joining us there on the line from Juba, South Sudan.